Keeping people safe in BC hospitals can be a dangerous job. Security guards are getting hurt, and new data obtained by CBC News shows just how often. Last year, WorkSafe BC accepted 170 injury claims. That's an injury claim nearly every other day. One security guard who spoke to CBC News says he's filed 3 WorkSafe claims in the last year and a half. He did not want to be identified because he's worried he could get fired. He says, "I've been punched in the head, being spat on, being headbutted, being bitten by violent patients." Here's what we've learned about where the injuries are happening. Accepted injury claims were the highest in Fraser and Providence Health, 50 accepted claims in Fraser Health and 46 in Providence. Security guards in Interior Health were off work due to injury 27 times and 22 times in Vancouver Coastal Health.
That could be a tip of the iceberg.
The province tried to address violence in hospital 2 years ago by creating a new class of security guard. Relational security officers, or RSOs, are unionized health employees. CBC News spoke to 3 relational security officers who say they're not being given the training or tools to keep themselves safe. RSOs working in Fraser Health and Providence Health are not allowed to use handcuffs to restrain a violent individual. Those who spoke to CBC say that puts them at further risk of injury as they try and hold someone until police arrive. The BC Conservative public safety critic thinks guards should have more training and better equipment. Eleanor Sturko connected CBC with the security guards we interviewed.
They are not adequately trained to deal with the level of violence that they're experiencing in the workplace.
She thinks BC should follow Alberta's example and equip guards with a firearm, taser, and handcuffs, similar to transit police. In Alberta Health, protective services officers must complete an intensive training course, which is similar to that provided to correctional officers or sheriffs. The Hospital Employees Union says that goes too far.
Relational security officers are not protecting buildings. They're protecting people. And people come into healthcare with very challenging needs.
Fraser Health says in a statement it's reviewing its handcuff policy and expects security officers to be able to use them in the coming months. Health Minister Josie Osborne was not available for an interview, but the Health Ministry says it is looking into other tools to make hospitals safer, such as using artificial intelligence to detect weapons in emergency rooms. Katie DeRosa, CBC News, Victoria.